There is such a great need out there that it's not all about medicines, it's not all about physiotherapy, going for x-rays, etc. It is about sitting down and spending time with somebody.
We have here a multidisciplinary team which certainly helps patients with medical issues and environmental issues, but we didn't have anybody helping patients with the social problems, and that has a big impact on our appointments.
And we started the process of developing our social prescribing scheme in 2015 when we seconded a person from public health from West Sussex to help us develop the program, working with our Borough Council, with our third sector providers and with the CCG.
Every single person is different, they're unique, they're individual, their needs and their wants are very different to the next person you're going to see. So I think being able to focus on that individual and not stick them in a box is very, very important.
I helped Tracy start social prescribing. Initially we had a chat about it and decided how we were going to make it work. Once we started the process, a few other practices came on board.
It started with a massive bang. So 50 referrals on day one, which was absolutely amazing.
Social prescribing is for patients over the age of 18 currently, and it is based on need, and especially when there is a lot of social need.
Personally, I find that the receptionists, the admin team, they sometimes know the patient better.
So a lot of the referrals were done through the reception team, who know the family, who know the history.
That is important because in our surgery, 80% of all the social prescription referrals are done by our practice staff, not by GPs.
Where as a receptionist or an administrator on the phone, for instance, might spend 10, 20, 30 minutes talking to that individual, they sometimes know that person a lot better.
Our majority of referrals came from the reception side.
So we identify patients through our risk stratification tool as one of the things, but also our clinical knowledge and our staff knowledge about the patient, but also understanding what the opportunities social prescribing provides to this person. So the practice needs to know, the practitioners need to know, so that we can direct the right patient to the service.
First of all, the patients have to have one medical problem.
I would say majority of the people that have currently benefited from the project are those aged 60 and over, but there are quite a few people aged 18 and over that are benefiting as well.
So it is based on the patient who has the greatest and most complex need, who would benefit from a social prescription. So being able to have social contacts, to be able to do exercise, to be able to lose weight, to be able to live the life better.
And then during that conversation, the ladies and doctors and nurses would introduce social prescribing. They would tell the patient a little bit about it. Sometimes the patient's a little bit hesitant. So what would happen, once they have that knowledge, we can say to the patient, you can pop back at any time, just let one of the reception staff know, or next time you see a clinician, let them know. Or we can ask Tracy to give you a telephone call, or you could come and meet Tracy just to explain about it. Sometimes they'll take that information, store it, and then come back to us when they need to access the services.
And the opportunities are not only with the health service, but they're also in the community, and that's what we want them to use.
And often it's just that lack of confidence for the patient to take that first step, because it is a step-by-step process. We don't expect them to go, fabulous, we'll do that straight away. They just need to think about it for a little bit and then move forward with it.
So the surgery is somewhere where they go, where they feel safe. They trust the surgery, they trust the staff there. So straight away, for the referral to come from the surgery already tells that person that actually the GP, the surgery, thinks that this is important and then they need to try this out. So I think that's a really, really good starting point for them.
Once we have a patient in front of us that has a problem, we can refer straight away. and we didn't have that before. It was just what would we do with that patient? They would come back for another review with the doctor, with the nurse, maybe a mental health review, maybe a depression review, and having that link with Tracy now just reduces that. It's fabulous, yeah.
I'm able to go onto the system at the GP surgery, just have a little look at the history of that individual to make sure that it's an appropriate referral, contact that individual, make an appointment to go and see them either at home, here at the surgery, or somewhere out in the community that's more convenient to them. And we start off with an assessment. I spend an hour with them, just finding out what kind of support network they have in place. Do they have basic things like a lifeline, for instance, if that's appropriate? Do they have people that come in and see them on a regular basis? If they're housebound, how do they get their food delivered? So there's a lot of basic things that we tackle first. And then from there, just very, very informally, I delve a little bit deeper, and then we explore the opportunities that are out there in the community for them. There's a whole raft of services. In our menu, we've got about 38 to 40 organisations that are signed up to social prescribing. So we've got a little process that we follow with these organisations.
You know, for some people, it's take them out of themselves, go somewhere where they can make friends, new contacts, and just have a good time. Because I think some people maybe are sinking under the weight of their anxiety or the depression. They've forgotten what it feels like to have a good time, and it's stimulating. Take it out of yourself, and they can turn corners that way.
You know, everyone says when they come along, and you know, you can see in their faces what a difference it makes. And
we have a whole host of patient stories which say how wonderful it is for them, how life-changing it is for them to have social prescribing help them through a very difficult time. And once they know how to do it, their own self-care becomes much better. We've just supported them through the self-care part of it.
And I think it's important that there is so much out there, because one size doesn't fit all. Everybody's different.
For the community in Crawley, I can see nothing but good coming out of this, because it's a win-win. It's in every direction.
When we started it, there wasn't that great evidence which showed the benefit of social prescribing. Now we know that in other areas, approximately 20% less people go to hospital who are in social prescribing schemes, and 20% less GP attendance.
Yeah, I think what we've got to do, those of us that know it works, we've got to use that hard evidence, and we've got to get that across to the movers and the shakers, the people who've got the handles on power and on grants and on the finances and the resources. And we've got to get it out there. It's not well enough known yet.
What we need to now do is make it part of what is normal for our country.